how the large surge in Omicron infections was likely to peak in January and then recede into February. In the weeks since the modeling update, there are early indications that infections may have peaked at the national level, including daily case counts, test positivity, RT, or the effective reproduction number, and wastewater surveillance trends. However, daily hospital and ICU numbers are still rising steeply, and many hospitals across Canada are under intense strain. Nationally, the average daily case count has decreased by 28% compared to the previous week. Although there is a degree of underestimation due to current testing policies, the 7-day average of close to 27,000 cases reported daily as of January 19th shows continuing high rates of infection. As well, with over 22% of lab tests positive for the COVID-19 virus, disease activity remains widespread across the country. Modeling also showed us that the high volume of Omicron cases was expected to result in an unprecedented number of new daily hospital admissions exceeding historical maximums. Over the past week, an average of over 10,000 people with COVID-19 were being treated in our hospitals each day, surpassing peak daily numbers for all previous waves of the pandemic. This includes over 1,100 people in intensive care units, which is higher than all but the third wave peak. During the same period, there were on average 131 deaths reported each day. Evidence continues to show that being vaccinated with 2 or more doses of COVID-19 vaccines lowers the risk of hospital admission. As well, having a booster dose of either Pfizer-BioNTech or Moderna mRNA COVID-19 vaccine helps improve protection that may have decreased since the second dose and results in a better protection against severe illness from Omicron in particular. With over 6.5 million eligible Canadians needing a first or second dose of the primary series, and many others who are eligible for a booster dose, there are still more opportunities to enhance our protection individually and collectively with COVID-19 vaccines. Among adolescent and adult age groups, vaccine coverage with 2 or more doses range from 83% to 96%, with room for improvement, particularly on booster dose coverage for adults, which ranges from 21 to 75%. For children aged 5 to 11 years, who more recently became eligible for COVID-19 vaccination, the key opportunity in getting more children on the path to vaccine protection by starting their primary series and raising vaccine coverage up from the present 51% with at least 1 dose. One of the ways we work to build confidence among this age group is through the Immunization Partnership Fund, or IPF. The IPF supports trusted organizations across Canada to share credible, timely COVID-19 vaccination information with their communities. These organizations can help reach underserved and under-vaccinated populations with tailored outreach and interventions to fill information gaps and reduce vaccination barriers. Next Thursday, a number of organizations, including IPF-funded recipients, Children's Healthcare Canada, and Signs Up First, as well as experts from across disciplines, will be coming together to promote vaccine confidence and highlight the importance of building up protection among children during National Kids and Vaccines Day. I encourage parents and guardians, together with their children, to take the opportunity to engage with experts and advocates that respect and support the need for informed and confident decision-making. Though we still have some difficult weeks ahead and potential for more bumps along the way, our many months of efforts have given us better protection with vaccines and brought us several effective treatments that we remain hopeful will change the face of the pandemic to reduce severity going forward. We can all help to ease the path to better days ahead by getting our COVID-19 vaccines up to date and continuing to reduce infection rates by layering personal protections such as masking and limiting in-person contacts as much as possible. So thank you. Merci. Megwich.
Bonjour à toutes et à tous.
Hello.
Last week's modeling update illustrated how the large surge in Omicron infection was likely to peak in January. It would then recede into February. In the week since the modeling update, there are early indications that infections may have peaked at the national level. These indicators include daily case counts, test positivity, RT, or effective reproduction number, and wastewater surveillance trends. However, daily hospital and ICU numbers are still rising steeply, and many hospitals across Canada are under intense strain. Nationally, the average daily case count has decreased by 28% compared to the previous week. Although there is a degree of underestimation due to current testing policies, the 7-day average of close to 27,000 cases reported daily since January 19th shows continuing high rates of infection. As well, with over 22% of lab tests positive for COVID-19, disease activity remains widespread across the country. Modeling has also showed us that the high volume of Omicron cases was expected to result in an unprecedented number of new daily hospital admissions. These would exceed historical maximums. Over the past week, on average, an average of over 10,000 people with COVID-19 were being treated in our hospitals each day, surpassing peak numbers for all previous waves of the pandemic. This includes over 1,100 people in intensive care units, which is higher than all but the third wave peak. During the same period, there were on average 131 deaths reported each day. Evidence continues to show that being vaccinated with 2 or more doses of COVID-19 vaccines lowers the risk of hospital admission. As well, having a booster dose of either Pfizer-BioNTech or Moderna mRNA COVID-19 vaccines helps improve protection that may have decreased since the second dose and results in better protection against severe illness from Omicron in particular. With over 6.5 million eligible Canadians needing a first or second dose of the primary series, and many others who are eligible for a booster dose, there are still more opportunities to enhance our protection, both individually and collectively, by using COVID-19 vaccines. Among adolescents and adult age groups, vaccine coverage with 2 or more doses ranges from 83% to 96%, with room for improvement particularly on booster dose coverage for adults, which ranges from 21% to 75%. For children aged 5 to 11 years, who more recently became eligible for COVID-19 vaccination, the key opportunity is getting more children on the path to vaccine protection by starting their primary series and raising vaccine coverage up from the present 51% with at least 1 dose. One of the ways we work to build confidence among this age group is through the Immunization Partnership Fund, or IPF. The IPF supports trusted organizations across Canada to share trusted, credible information on COVID-19 vaccine with their communities. These organizations can help reach underserved and undervaccinated populations with tailored outreach and interventions to fill information gaps and reduce vaccination barriers. Next Thursday, a number of organizations, including IPF funding recipients, Children's Healthcare Canada, and Science Up First, as well as experts from across disciplines, will be coming together to promote vaccine confidence and highlight the importance of building up protection among children during National Kids and Vaccines Day. I encourage parents and guardians, together with their children, to take the opportunity to engage with experts and advocates that respect and support the need for informed and confident decision-making. Though we still have some difficult weeks ahead and potential for more bumps along the way, our many months of efforts have given us better protection with vaccines and brought us several effective treatments. We hope they will change the face of the pandemic to reduce severity going forward. We can all help to pave the way to better days ahead by getting our COVID-19 vaccines up to date and continuing to reduce infection by layering personal protection measures, such as masking and limiting in-person contacts as much as possible. Thank you. Merci, miigwech.
Okay, thank you so much, doctors. We have quite a bit of time for questions today, but given that we had very few people able to get through on the phone lines on Monday, I'll ask for questions to be brief and answers as well to be brief if possible. We'll start in the room with Mackenzie Gray and then go to the phone lines.
Hi, Dr. Tam. My first question is about a study that came out with the CDC today. There's some really strong numbers about boosters. 90% effective against hospitalizations, 82% effective against preventing people ending up in the hospital. And people with a booster are 66% less effective to end up getting an infection against Omicron versus people who only have 2 shots. The top CDC advisors already come out today after this and said, look, we need to change the definition of what it means to be fully vaccinated to be 3 shots. So now is it only a matter of time in Canada that 3 shots is going to be the standard for fully vaccinated versus 2 shots?
And I think it's very important to get the booster. So that is the first message, as I've said in my opening remarks. So everyone should try and get the boosters as soon as they're eligible. And that's really important. I think it depends on the objective of what the definitions are used for. And a lot of it in the jurisdiction of the provinces and territories. But we will be discussing this going forwards, as I said, once there's been more people who are having had the opportunity to access the booster doses.
On kids, you mentioned...
Dr. New, maybe I could just add to that. I think there's sometimes maybe a bit of confusion, I think, in the general public as to, what is a booster dose. And so I think what Dr. Tam and I are sometimes use the phraseology is better sort of keeping up to date with your vaccinations, because let's say for the large part of the population, maybe getting 2 doses, maybe 8 weeks apart and so might constitute what we call a primary series. You get a good level of immunity from that. But for others who may not be able to mount a good immune response, maybe their primary series might actually consist of 3 doses as opposed to the 2 doses. So and then after that, if you have a good response from your primary series, then a booster dose is the one that you might be giving 6 months or later after that sort of completion of your primary series to then bring your immunity up after it wanes over time. So you're right, there's still lots to look at, and Nancy will be looking at sort of the overall question of booster doses and the timing, but I just want to maybe clarify that issue in terms of what constitutes the number of doses in a primary series versus boosters. Thanks.
On kids, Dr. Tam, you mentioned in your remarks that only 51% of eligible kids are fully vaccinated at this point in time, which means that there are a lot of parents out there who are fully vaccinated themselves but have decided not to make sure that their kids get vaccinated. Why do you think there's such a disconnect, potentially with hundreds of thousands or millions of fully vaccinated parents not letting their kids or not wanting their kids to end up getting vaccinated?
Because I think we need to look at the reasons behind this more closely. But what I do know is before the program started, that there was a very high proportion of early adopters, around 50%. So maybe that's what we're seeing. But there were quite a high proportion, 25 to 30%, I believe. I can't quite recall the exact public opinion research numbers, but around that sort of ballpark of parents who are just waiting and seeing, because of course children are very important in their lives, and their primary piece of information they wanted to know is, are the vaccines safe? And so I think we can now safely say that millions of doses of the Pfizer lower dose vaccination for children have been deployed. There's no safety signals of concern. And so I think it's this group of parents that we're hoping to reach in so many different ways, as I've said, with the Immunization Partnership Fund, to make sure parents and kids get their questions answered. So I think this is the next phase to try and get that next group of kids vaccinated. And some of our experts will be providing their time next week to answer those questions. So both access to information and easy access to the vaccine, I think is very key for the next phase.
Okay, Patrick, we'll go to you on the phone lines.
Thank you, merci. You may press star 1 at this time if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Boris Proulx, Le Devoir.
Boris Proulx from Le Devoir, you have the floor. My question is on border testing and in airports. Are you concerned by the positivity rates that we're seeing for these tests? Do you think Canada should continue or stop systematically testing travelers, specifically from the United States? Answer. Thank you for the question. This is Dr. New. Maybe I'll answer first. Of course, it's always important to follow the data that we get at the borders. We need to understand the positivity rates among travelers. We've seen that positivity rates have increased over the last few weeks. This demonstrates the importance of the measures that we've implemented at the borders to protect the health and safety of Canadians. It's also important for monitoring. It's not just about diagnosing individual travelers. We want to be able to detect any new variants, for example. This is part of our border screening program. Of course, we are continuing to assess our efforts at the border as the situation evolves. And this is about the evolution of the situation in Canada and worldwide. We will continue to adapt as necessary. Thank you. There are also some provinces that are starting to loosen restrictions starting in February. Do you think this is appropriate, and do we have sufficient rapid tests for this next stage? Answer. This is still Dr. New. Thank you for the question. You know, Canada is a large country. The experience of each province and territory is different. Even with Omicron, we saw that the two largest provinces, Ontario and Quebec, had their Omicron wave first compared to the other provinces. So it's up to provincial authorities and territorial authorities to understand their local epidemiology. They need to consult with experts on modeling and use data in their own jurisdictions in order to make these decisions and decide whether or not to loosen restrictions. For me, it's difficult to speak for each province and territory. Of course, my counterparts are very attentive to their own situations, and they are keeping their eye on the data, and we leave it up to decision makers to use this information.
David Aiken from Global News. Please go ahead.
Well, thank you very much, doctors. Appreciate your time. Maybe Dr. Tam, this is for you. It sort of goes to that fund announcement today about disinformation. We have some new polling that suggests Canadians do have some concerns about getting ever more COVID-19 shots, boosters. And I know, Dr. New, you were saying, it's important to keep up to date on vaccines, but a lot of Canadians, when asked, would you get a fourth dose? They sort of roll their eyes and go, they seem to be resistant. So I'm wondering if you have some thoughts about how our vaccine strategy might change, the communications. Is it likely we'll need annual boosters, strain-specific vaccines for the most vulnerable only? I wonder if you could speak about the vaccine strategy in a climate where people are wondering, I got to get a fourth dose or more doses.
Yes, I think we have to examine, of course, the data in numerous streams, including the level of protection, the vaccine effectiveness studies. I think we were very fortunate to get some very effective vaccines quite early on in the pandemic, and we're essentially learning about some of the spacing in the doses and the number of doses required. But at the same time as studying that, the virus itself is also undergoing evolution. So there's another stream of data that we need to watch out for. But what we will say is that I think the global opinion at this point is that the Omicron virus is going to be with us for some time. So we do need to take a longer term approach in thinking about a vaccine strategy. So I think that's the next step, and we need to do that with the National Advisory Committee on Immunization. Of course, they've been asked to examine the need, for example, of a fourth dose, but they are taking very thoughtful approaches to examine that question. But I think everybody would appreciate that for influenza, for example, that's now an annual vaccine. People have had that. I've had that for decades, every year. So it's not a question of whether many different doses in our lifetimes is a concern. I think we have very good examples of where vaccines can be given time and again over the course of our lives. But it is, I think, quite an important moment. And then the next year, leading up to the next respiratory virus season, to try and work this out as much as possible. So there are a number of unknowns, as you've pointed out, in terms of, what strain should we be using and who needs to get an additional dose. I do think that the primary objectives have to be clarified. And right now, I think the key is to prevent serious outcomes. And we need to look at that going forward as well.
And just a data follow-up, really. This may be available at somebody's dashboard. I just haven't seen it. Dr. Tam, you talked about the number of people in hospitals, the number of people in ICUs with COVID. Do we have a rough idea of how many of those in hospitals or in ICUs are dealing with Omicron or Delta or even the Alpha variant? Do we know or have some data, some perspective on which particular variant is pushing up these hospital counts?
Yes, not everyone in the hospital will have genetic sequences done. Some will get targeted genetic screening to look at what we call an S gene dropout. So you will not get that precisely from every hospitalized patient. But what we do know is from our surveillance system that is almost all Omicron. Ever since around December the 20th, as Omicron began to really take over the majority of the genetic landscape, as it were, that's what we expect to be in the hospitals right now. We're not seeing much in the way of Delta or any other variants, but we're monitoring that very closely. And by the way, including the sublineages of Omicron, which is getting a bit of news today, I think.
Thank you. Merci. La prochaine question de Louis Blouin.
Louis Blouin, Radio-Canada. You have the floor. Hello. I would like to talk about screening in airports. Systematic screening is happening right now for all passengers. Many experts are saying that it's no longer necessary to screen all travelers arriving in Canada, especially because the processing delays are very long. Are we going to go back to random testing in airports? Answer, thank you for the question. This is Dr. New. I think we've already answered that question, but I'm happy to repeat it. Yes, it's still important currently to maintain the measures we have at the borders. We will be using the data and the results and make adjustments as necessary. We are continuing to assess the situation given the results we're seeing now on the field and at the border. As the situation evolves, we will analyze the data and give recommendations for adjustments as necessary. Question. So are any adjustments coming in the coming days? And second question, there's another rule that affects many Canadian families. Younger children cannot be vaccinated, and when they come back to Canada, they can't send their children to daycare for 14 days after their return. Some provinces have reviewed the rules, but the federal government guidelines seem to be contradicting what is happening. Mrs. Demers said that this restriction is no longer sensical. Are you going to lift this restriction? Answer. That was very specific, but yes, we do agree that it's important to reassess our border measures. With the arrival of Omicron and what's happening in Canada, we have to assess our policies at the border. We have to be ready to adapt and adjust measures as appropriate. Thank you.
Thank you. Merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead.
Hi, good morning. I'm curious if you could talk a little bit about the death rates that we're seeing and the death numbers we're seeing from COVID this particular month. The numbers seem to have climbed substantially, including among children. And I'm just wondering if that's severity related or if this is still because there's just so many people getting Omicron.
Mhm.
Yes, I think this is Teresa Tam. I'll answer your question first. I think it is the sheer volume of cases. And at the beginning of the Omicron wave, it was very much concentrated on younger adults. And then it began to spread into the other age groups, as one might expect. So I think the vast majority of the severe outcomes, though, are still in the elderly population, people who are over the age of 60, the key population groups ending up with the more severe outcomes in the hospitals. And the mortality is the highest in the very oldest age groups. So that is still the trend that we're seeing. There may be some reports of severe outcomes in children, but they're still very rare. In terms of rates, they're still very low.
Thank you. And earlier this week, you were at the Health Committee and you were asked a few times about the quarantine period, the isolations that have been lowered in most provinces now. I'm wondering if you could say what advice the Public Health Agency is giving provinces about easing these isolation dates from 10 to 7 to 5 days, et cetera, and what role testing should play in the decision about whether or not someone should come out of isolation.
Yes, at the Special Advisory Committee, we share information and the synthesis of the evidence that we have gathered on an ongoing basis with the provinces and territories. In terms of the isolation period, for example, there was very little information, as you can imagine, coming out at the beginning of the Omicron wave. And then there were a few studies that were being published which suggested that the period during which you can shed the virus and can potentially communicate is not that different from other variants. Having said that, there's a massive number of cases. And this has a great impact on our society, on our critical services, on the healthcare service itself. So provinces, recognizing the data that we have, made the decisions from a policy perspective and a business continuity perspective, for example, to adjust some of the policies. But all of them have said that regardless whether it's 5 days or 7 days, for the rest of that period, you have to wear a well-fitted, high-quality mask and take on those other layers of protection because there's always a possibility that transmission could occur. So those are ongoing discussions for sure. And the same with the quarantine period in terms of, well, exactly what is the incubation period, what is the latent period. So we have those technical discussions, but in the end, provinces have the tough job of making it work on the ground. And I think that's the situation that we're in now.
Thank you, merci.
Discussions for sure. And the same with the quarantine period in terms of, well, exactly.
I'm sorry, Madame Guillemette.
Madame Guillemette, your line is on, and we can hear the webcast of the press conference. Can you turn the volume down?
Of Dr. Tam on the line could stop.
Discussions for sure. And the same with the quarantine period.
Madame Guillemette.
Madame Guillemette, you have the floor. No, your line is on and we can hear you.
Question is from David Thurton from CBC News. Please go ahead.
Hi, yes. This question is for Dr. Tam.
Was she the same person?
The Institute of Health Metrics and Evaluation out of the University of Washington has said today that the pandemic is winding down. The pandemic is winding down and will be over by April, with COVID essentially becoming a seasonal flu. So, Dr. Tam, your thoughts on this, please.
I think that there are many experts in the world trying to work out this question, and I don't think the what you just said was, is necessarily the scenario, but it is a possible scenario. So I think we need to prepare for different potential futures. I think one of the scenario is that, of course, after this massive Omicron wave, and we have boosters and more kids are getting vaccinated, the population should have a reasonably good immunity, at least for this period of time, and at least against the Omicron variant. So we need to see how that immunity continues. We know that waning immunity does occur, and we need to prepare for any potential unusual variants that might come along. At the same time, though, we do need to lay out a strategy and a plan towards moving back to something that is nearer normality. And I think one thing that many experts do agree on is the Omicron, well, not the Omicron, the COVID-19 is going to stay, and the coronavirus will continue to be in the human population. So how do we manage that going forwards? I think it's quite reasonable to think that we need to plan for the next respiratory virus season as well.
Thank you for that. The same institute also suggests that the Omicron wave will essentially be over in a few weeks, and that it will be time to lift mask mandates, vaccine passports, and other restrictions. So yeah, your thoughts on that as well, Dr. Tam.
I think we gave some idea at the national level as to where this wave is going. So I think in the January timeframe, the peak may occur, but the hospitalizations and the ICU admissions may continue to increase for some time. So that's in February. And I really hope that by the end of that next month, we'll be in a better position. And during that time, people are very busy, of course, responding to the Omicron wave, but we need to plan ahead for the next phase. And that, we have to focus on our goals, which I think has been articulated as reducing severe illness and severe morbidity and mortality, as well as reducing societal disruption. So that balance has to be worked out. There is no doubt that nobody wants to have all these restrictive measures anymore, and Omicron may or may not have put us one step towards that newer reality. So I think, as I said, we need to plan for the different scenarios and just be ready. for a time of emergence of new variants. But we got to move on and see how we can make our societal functions closer to what they were before the pandemic.
It's Dr. New. Maybe I can just comment further. You're mentioning two tools and sort of the word mandates attached to that. I think the way I look at it, you were talking about vaccines and masks. I think, from a public health perspective, we want people to be sort of informed and make that a voluntary choice, to get a vaccine, because we know that vaccines are a very important tool, safe and effective in terms of how we manage not just the Omicron variant wave right now, but just for COVID-19 into the future. So I think that's something positive we need to keep building on. And as far as the use of masks, as you put it, I think it's I think in many ways an empowering sort of personal protective measure that people should be encouraged. It doesn't have to be because there's a mandate. It's because people see the value in and of itself to protect themselves and protect others to wear a mask. And maybe even in the future, it's not because of COVID-19, but also maybe for other respiratory viruses. And maybe they'll get baked in, as they say, in terms of a sort of a good personal protective habit that will always, maintain, through, let's say, winter and respiratory virus season. So that's how I would look at it in terms of looking at the sort of the negative way in terms of, we can lift mandates on masks, etc. Thank you.
Thank you, merci. La prochaine question.
Raphaël Pirot, Agency QMI. Hello, thank you for taking our questions. Canada has among the lowest rates of beds in hospitals of all OECD countries. Do the few beds that we have affect our management of the pandemic? Answer. Thank you. I'm a public health specialist. Dr. Tam and I are specialists that analyze data, and we generate recommendations to decision makers to allow them to manage the pandemic. The question you ask is really about infrastructure and the healthcare system. We know that in some provinces, capacity can differ from another. It's not up to me to speak to pandemic management as it relates to the number of beds in hospitals. We can see what's going on in Quebec with their capacity. Their healthcare system is experiencing great pressure. Hospitals are under strain. The government of Quebec is continuing with public health measures that are extremely strict, very restrictive, to protect their healthcare system. It's a good question and something we could look into later to find what a good balance is of capacity for a healthcare system in order to be ready for the next pandemic. But currently, we are doing everything that's necessary to protect our healthcare systems in each province and territory. Thank you. Question. The Canadian government has ordered mobile healthcare units. Maybe the answer will be the same, but I was wondering if on your end you recommended that these mobile units be deployed to the provinces and territories. They were received at the end of 2020, and they're being underutilized. Is this something you've considered, the fact that these units are not being used right now? Answer. Thank you for the question. I don't have the details, but yes, we do have mobile units, as you mentioned. The federal government is always ready to respond to requests. Maybe a province exceeds its capacity to manage the pandemic in a given hospital, and so we are ready. This is part of the plethora of options we have to offer the provinces and territories, but I don't have specific details about individual requests from provinces and territories. This is among the options that are available to provinces and territories.
Thank you. Merci. The next question is from Raisa Patel from the Toronto Star. Please go ahead.
Thanks for taking our questions. Dr. Tam, back in December, you published an annual report in which you said Canada was not prepared to handle a crisis of the magnitude of COVID-19. At the time, you said it was too early to know how Omicron would impact our pandemic response. But now that we have a better understanding of Omicron, do you think this country was not prepared to handle that variant as well?
I think this pandemic has affected every country in the world, and Canada is not any different. But to sustain this response for this long is also a massive challenge. And I think, based on the last set of questions as well, that it's really difficult to maintain the health system as a whole functioning for this long with this much pressure. So I think a lot of our pandemic response to the Omicron wave, or this current wave that we're in, much of it is to protect that health system, particularly the healthcare system, from being, really under pressure. So I think Canadians understand that that's partly why, on the ground, some of the measures had to be enacted, because you can't cope with this level of ICU admissions and hospitalizations without some major impacts. And what is different about this wave compared to others is the absenteeism, and because of the infection rates and the high transmissibility of the Omicron wave. So it is quite a challenging wave. Which is different from other waves is the continuity of the health human resource. And so I think those challenges continue. And but of course, we're not alone in that. And but again, only together and by supporting our health systems can we get through this.
And as a follow-up, then, do you think that the federal government should have done more since the onset of the pandemic to help provinces and territories expand testing capacity and healthcare capacity to prepare for surges like the one we're seeing now?
Well, I think, everything is being done to try and support those things. As I understand it, you can try and buy up as many tests as possible, et cetera, but there's deployment on the ground that needs to be done. And some of it is, some of the testing limitations is not because you don't have enough PCR testing lab infrastructure, it's because some of the people were sick and some of the people who collect samples were sick. So it's a very different scenario to be working with. But I think getting enough vaccines, making sure there's boosters, continuing to supply the testing support as fast as much as we can. Those are some of the fundamentals, and of course, evolving our guidance to make sure Canadians can protect themselves as much as possible. In a pandemic scenario, for example, for influenza, where we did envisage scenarios where everybody has a synchronous wave, more or less, and you're all impacted, and the ability to provide surge and help each other in mutual aid is very difficult to sustain under those circumstances. And so pandemic plans always have to deal with prioritization and those difficult decisions that have to be made. So I think, I believe everyone is doing the best that they can, but I think ahead of next winter, we need to plan ahead and see what we can do to make sure the systems are as sustainable as they can. But I think everybody that I've talked to have said is the exhaustion of the health human resource and the sickness.
Moderator, how many more questions do we have on the phone line?
We have at this time 2 questions left.
Okay, great. If we could get both in, that would be fantastic. Thank you.
Certainly. La prochaine question.
Pierre Saint-Arnaud, Canadian Press. You have the floor. Thank you. My first question is about modeling. It seems to have been pretty accurate. We were expecting a plateau and then a reduction of cases starting in January. What is modeling telling us about hospitalizations that keep rising and intensive care? Thank you for answer. Thank you for the question. This is Dr. New. Yes, the modeling has told us that hospital admissions are a late indicator. So hospitalization happens a few weeks after infection. So if we see a plateau of cases, it tells us that we've reached the peak or we're close to the peak. And that we could be on a downward slope. We can see that with hospital admissions, we'll still need a few weeks after reaching the peak of cases. So if we've truly reached the peak of infections, it will take a few weeks before hospitalization rates to start dropping. This is using the data we have now, but things can change at any moment. It's really about collecting more data and continuing to work with experts in the field. Thank you. Second question. You've said 6 million Canadians are not vaccinated. There's an important proportion of these people who do not want to be vaccinated. They won't do it. Are we ready to manage the future with such a high proportion of people who are not vaccinated? What are the implications on a planning perspective? Answer. This is a great question. I think it's still very important. These unprotected, non-vaccinated people give the virus an opportunity to continue to spread. We can still see important transmission in some communities. So through planning, we are continuing to encourage people to get vaccinated and to increase our vaccination coverage. If we think about how our society functions, we have to encourage people to get vaccinated using all of the measures we have at our disposal. The well-informed population that appreciates science has already been vaccinated. To motivate the others, we might have to grant privileges to those who are vaccinated. For example, accessing public spaces and restaurants, that's one way. But I think it's very important to continue with our efforts. It's never too late. Even today, if you're among the 6.5 million Canadians that are eligible for a vaccination, go get vaccinated. It's never too late to get a first or second shot or to complete your initial series. We're going to continue in that vein. But beyond that, we want to look at what else we can do with regards to other available measures.
You may still press star 1 if you have a question. Vous pouvez toujours appuyer sur étoile 1 si vous avez une question. The next question is from Christine Barak from CBC National News. Please go ahead.
Thank you both for taking our questions. Mine is on the rapid test front. Based on a research project, Nova Scotia Health is now recommending people swab both their nose and throat to get more accurate rapid test results. Just wanted to get your sense of that approach and the latest data on this. People are, to some degree, relying on these tests. What should they be keeping in mind?
Yes, thank you for the question. That's a great Canadian study. So we really welcome that. We actually had Dr. Hatchett present to the Chief Medical Officers very recently on his results. So we will be taking that into account. And I've asked our laboratory networks, our laboratory experts to take that into account and see whether we can provide some further guidance. But of course, I think we have been discovering that the Omicron virus may be behaving a bit differently to the previous variants. And so this approach to swabbing might be useful, but different kits have different swabs, and I learned a lot about that sort of recently. Some of them are more flexible, some of them are designed a bit differently. So I think the different kits need to be examined, but I think his study will go, is very welcomed and will go a long way in terms of helping us with our next set of recommendations. That's not to say that, well, what about the next variant? So I think it's really great that these studies are being done, and I look forward to our lab network maybe providing the next set of guidance that Canadians need.
What would be your, that's great, I'm glad that you're briefed on the research project, but what would be, based on what you've seen and I guess the amount of research you have done on your own recently, what's your best advice at this point for using rapid tests?
I think Dr. Hatchett's and his team's results is looking at how you swab, and in this current context, using the kits that he's examined, swabbing the back of your throat and then the nose area is potentially provides you with the highest yield. But if you can only do one site, go along with the manufacturer's instructions and do the nasal swab. So I think that's looks like some very sensible advice, because rapid tests, we got to make the best use of them. So if by some adjustments to the swabbing technique, we can get a high yield, that's always a great thing to do.
Operator, are there any other questions on the phone line? If not, we have one more in the room.
There are no further questions on the phone.
Okay, excellent. I will take this opportunity to ask Dr. Tam a follow-up from CTV's question for my colleagues in Toronto. You said that there is a question of definition regarding boosters and whether that's part of being fully vaccinated. Can you please explain what that question is? Are you questioning whether we need booster as part of the definition for fully vaccinated? Is that referring to an earlier question? I think. Yeah, it's referring to what you said to Mackenzie Gray. Okay, so currently, for a number of administrative purposes and on the ground in the provinces and territories, for going into a certain setting, for example, there is a definition for what fully vaccinated is, which consists of really the primary series. So a 2-dose vaccine, you need 2 doses. 1-dose vaccine, the Janssen vaccine, is that first dose. But we all know that it is very important to get the booster dose, particularly in the time of Omicron. So we began to switch terminologies now to the concept of being up to date. So by being up to date is if you are in certain age groups and you're eligible for the booster, getting the booster or the additional dose is what we mean by up to date. But that has not been built into the definition for administrative purposes of whether you can enter a certain space or going to a certain task, or indeed for international travel. That has not changed. It's still the primary series or the first 2 doses for the most part. But we will be re-examining those kind of policies going forwards. Particularly, now is not the right time because not everybody's had the chance to get that additional dose or getting up to date.
not in Canada and certainly not globally. So we will need to re-examine that posture in the future.
Thank you. And just going to Mia's question on the increasing death rates, regarding Quebec, is Quebec a leading indicator of what we will see in death rates across Canada? Or is there something different in the experience of hospital healthcare system in Quebec that is leading to higher death rates in Quebec than elsewhere?
I think Quebec is certainly one of the provinces that experienced the Omicron surge the earliest, so that could play into it. But there may be other factors as well, whether it's related to the actual impact of the Omicron wave in the Quebec population. But I think there were some questions about differences in methodology and reporting of the deaths. So maybe a number of these factors are playing into the different numbers. But all to say, though, is Omicron can cause serious outcomes. We cannot trivialize this virus. Many people who are, particularly those at high risk, can get very severely sick. And indeed, many have died, and we need to do what we can to prevent those.
Okay, that wraps up all our questions for today. Thank you both to Dr. Tam and Dr. New for being so generous with your time. Have a good rest of the day and happy weekend.
You too. Thank you.
Thank you. Bye-bye.